Bioethical Issues, Chapter 5, Lesson 2. When we say bioethical issues, it refers to the moral and ethical questions that arise in the fields of biology, medicine, and healthcare. These issues often involve complex decisions about human life, health, and well-being, can be influenced by various factors such as cultural, religious, and personal values. First, we have the beginning of life issues. Abortion. Abortion refers to the termination of a fetus. It can happen spontaneously, which we call a miscarriage, and in these cases, there are usually no moral concerns. However, when abortion is induced, meaning someone intentionally terminates a pregnancy, it becomes morally and ethically controversial. Ethical discussions on abortion revolve around the status of the fetus and the questions. So we have here 4 questions. First, does it have moral standing? Second, under what conditions is intentional abortion moral? Third, does it achieve personhood? If so, at what stage? And lastly, what constitutes personhood? Example, a woman discovers in her second trimester that her baby has a severe birth defect and decides to terminate the pregnancy. Ethically, some may argue for her right to choose, while others may focus on the potential personhood of the fetus. Assisted reproduction. Some couples can't have children because they miss a pregnancy milestone. In order to produce children without adoption, assisted reproduction technologies were developed. Assisted reproductive technology, or ART, refers to methods used to help couples have children without natural conception. This is especially important for those facing infertility issues. We have also some of the usual types of AR technologies. The first one, artificial insemination with the husband's sperm, or what we call AIH. The second, artificial insemination with the donor's sperm, or what we call AID. And the third one, in vitro fertilization, or what we call IVF, and the last one is surrogacy. Did you know that the AR technologies can also raise the following ethical issues, like unnatural methods, impact on family structure, attitudes toward infertility, suggests that infertility is a problem requiring medical intervention. We have here example like a couple chooses IVF after years of trying naturally. They successfully have a baby. Some may celebrate this scientific advancement while others may worry about the number of unused embryos or the emotional impact on the family. Cloning. According to Gregory Penn's 2009, the word clone is derived from the Greek word klon, or twig, referring to the plant reproduction process, where a new plant is created asexually by planting a twig in nutrient-filled water. Cloning refers to the reproduction of the genetic material of an ancestor organism without sex. Human cloning, though still not common in practice, raises serious ethical issues. And here are also some of the ethical concerns. High embryo mortality rates, the risk of birth defects or other health issues, the danger of treating clones as products rather than unique individuals. Example, if a couple loses a child and decides to clone the child, society might question whether the new child is treated as a person or as a replacement. Kant also believed that a human infant, a potential person, should not be exploited for something else. Instead, it should be treated as intrinsically valuable with moral rights of their own.
Sustenance of life issues. Organ transplantation. Organ transplantation is a medical procedure where a healthy organ from a donor, living or deceased, is transplanted into a person with a damaged or failing organ. It can save or extend lives. However, ethical concerns arise, such as how organs are sourced and whether consent was properly given. For example, a person with kidney failure receives a kidney transplant from a deceased donor. This saves their life, but questions may arise about whether the donor consented to donate their organs before passing away. Genetic medical procedure, and they have three types of it, like genetic testing and screening, gene therapy, and genetic enhancement. Genetic testing and screening. This procedure help identify genetic condition either in individuals or across a group. Testing focuses on individuals and the risk of developing a disease, while screening looks at larger population. For example, a woman with a family history of breast cancer get tested for the BRCA1 gene mutation to see if she is at high risk. Gene therapy. Gene therapy involves inserting correct genetic material into cells to treat or prevent disease. It targets the root cause of genetic disorder. For example, a child with severe combined immunodeficiency undergoes gene therapy to introduce a functional immune gene into their body. Genetic enhancement. This involves altering genes to enhance human abilities like strength or intelligence. It is still in experimental stage and raises ethical concerns. For example, scientists modifying genes in animals to increase muscle growth as a future possibility for human application. Healthcare resource allocation. This refers to how healthcare goods and services like medicine, food, and shelter are distributed, especially when they are limited. The goal is to use these resources fairly and effectively to improve public health. For example, during a pandemic, vaccines are first given to frontline workers and elderly people because of limited supply, showing how resources must be allocated based on priority and need.
End-of-life issues. Euthanasia is the act of intentionally ending a person's life to relieve their suffering, typically due to a terminal illness or incurable condition. There are different types of euthanasia. Number 1, voluntary euthanasia. The person requests to end their life. Number 2, non-voluntary euthanasia. The person is unable to make decisions and someone else makes the choice. And lastly, involuntary euthanasia. The person is killed without their consent. For example, a doctor administers a lethal dose of medication to a terminally patient who is in immense pain and requests to end their life. The doctrine of double effect. This notion of the double effect explains when it's moral to do something with both beneficial and harmful effects. Some think the following scenarios are ethically allowed. A. The act is not inherently morally good or evil. B. The negative outcome is not a necessary means to achieve the positive outcome. C. The intent is directed solely at the positive outcome. And D. There is a balance between the positive and the negative outcomes. For example, a doctor gives a patient pain medication that might hasten their death, but the intention is to relieve pain, not end their life. Brain death and vegetative state. Three major approaches to the definition of death. Cardiopulmonary approach, heart-lung approach. A person is considered dead when their heart and lungs stop working permanently. For example, a person is declared dead after their heart stops beating and they can't breathe on their own. Whole brain approach. A person is considered dead when their entire brain, higher and lower parts, stop working. For example, a person is declared brain dead after tests show no brain activity even if their body is kept alive on life support. Higher brain approach. A person is considered dead when the upper part of their brain, responsible for thoughts and consciousness, stops working. For example, a person in a persistent vegetative state who can think or respond but can still breathe on their own might be considered dead by this approach.
Information and research issues. This refers to the ethical concerns related to how information is collected, used, shared, and communicated in medical practice and research. These issues focus on protecting patients' rights and ensuring ethical standards in research. Truth-telling and informed consent. So we're going to discuss truth-telling first. Truth-telling refers to the obligation of healthcare professionals to provide honest and complete information to patients, especially about their diagnosis, treatment options, and prognosis. This is essential to uphold the patient's right to make informed decisions about their own health. Truth-telling is based on three principles. Number 1. Respect for the person, or the Kantian Principle by Immanuel Kant. This principle discusses that every person has the right to be treated with dignity and to make decisions about their own life. Lying or hiding the truth disrespects their autonomy. For example, a doctor should not hide a cancer diagnosis from a patient just to protect their feelings. The patient has the right to know. The second principle is the utilitarian principle, or the greatest good. This principle discusses that truth-telling can lead to the best outcomes for the most people, such as better decision-making and treatment compliance. For example, if patients are fully informed, they can follow the most effective treatment plans, leading to better health outcomes and resource use. The third principle is trust between doctor and patient. This principle discusses that honesty builds trust. Once trust is broken, patients may not believe future advice which can harm care. For example, if a doctor lies once, a patient may hesitate to return or follow treatment, fearing more dishonesty. Medical paternalism is when a healthcare professional makes decisions for a patient, believing it is for the patient's own good, even it goes against the patient's wishes or without their full consent. We're going to our next topic, which is informed consent. Informed consent is the process where a patient or a research participant gives permission for a medical treatment or to join a study after fully understanding the risk, benefits, and other important details. For example, before surgery, a doctor explains the procedure, its risks, the chances of success, and other options. The patient asks questions, understands the answers, and freely agrees to go ahead with the surgery. The next one is confidentiality. Confidentiality means keeping a patient's personal and medical information private. Healthcare professionals must not share this information with others without the patient's permission, except in special or legal cases. For example, a teenager tells a doctor about mental health struggles. The doctor keeps it private unless there is a serious risk of harm and informs the patient first if it must be shared. The Hippocratic Oath is a traditional promise made by doctors when they enter the medical profession. It's named after Hippocrates, an ancient Greek physician known as the father of medicine. The Code of Ethics of the Philippine Medical Association is a set of ethical guidelines for doctors in the Philippines, based on both international standards and local cultural values. The use of human for research. This means using people as participants in scientific or medical studies to learn more about diseases, treatments, or how the body works. Because people are involved, ethical rules are very important to protect them from harm and to make sure they are treated fairly. The Nuremberg Code, 1947, was created after World War II, when Nazi doctors were put on trial for doing cruel experiments on prisoners without their consent. The main message of Nuremberg Code is people must never be forced into experiments, and their safety must come first. The Nuremberg Code established a 10-point set of rules, including voluntary consent. which means people must freely agree to join the study. This also includes risk-benefit assessment. This means the benefits of the research must be greater than the risk. And this also includes competent investigators. Only qualified and experienced professionals should conduct medical research. The Declaration of Helsinki, 1964. This was created by doctors to update and improve the Nuremberg Code. It's used worldwide to guide ethical research involving humans. The main message of Declaration of Helsinki is that the health and rights of the person in the study are more important than the study itself. To be ethically sound, there are foundational basis requirements for research and must be based on three principles. The first principle is the Kantian principle of respect for persons. The Kantian principle of respect for persons emphasizes that every individual has the right to autonomy and dignity. In research, this means that the participants must be treated with honesty, given full information about the study, and allowed to make free and informed choices without coercion. The second principle is the principle of beneficence, or the utilitarian principle. The principle of beneficence based on utilitarianism requires researchers to maximize benefits and minimize harm. It focuses on doing good for individuals and society, ensuring that the positive outcomes of the research outweigh the risk. And the last principle is the principle of justice. The principle of justice demands fairness in the selection of participants and the distribution of both the benefits and burdens of research. No group should be exploited or unfairly treated, and all should have equal access to the potential advantages that research may bring. In promoting distributive justice, Luna and McLean, 2012, suggested the following premises. Research must be responsive to health needs and priorities of the population where research is conducted. Number 2, it is unjust for research subjects to be worse off after the study than during it, particularly if they are denied necessary treatment once their participation ends. And lastly, external sponsors must provide some post-trial benefits to the community.